Hello, I had a really bad morning, and I'm going to share that with you. Not because I like to whine, I do, but it occurred to me in the middle of this episode. I had a hypoglycemic episode about 4 in the morning, and it occurred to me about partially through this episode that it would be helpful to share with others what happened. You know, there are a couple of things that you would think an ER doc might learn. For example, I started off as an ER doc, and the simplest thing to treat was somebody coming in hypoglycemic. You give them an amp of D50. What that means is you put in an IV access, you give them a bolus of concentrated sugar. They pop right up. They feel great. Now, to try to get somebody to eat something, when you get really low levels, your epinephrine is firing off, your adrenaline is firing off dramatically. It can make you very nauseated and even vomit. So it's hard to get sometimes to get the patient to get their head around anything, much less eating. So, and you'll see that during this episode. There's several other things that you can learn from this episode too, especially if you're a baby boomer. And we'll talk about impact for baby boomers a little bit later. So here's what happened. About 4 a.m. I woke up. I felt awful. I felt just like I have many times through my adult life, usually once a week, because I'm a distance runner. And not the first night after a long run, but the second night, 36 to 48 hours after a long run, I would feel really bad. I woke up at other times too. Actually, my father did as well. Often at 3, 4 in the morning, couldn't go back to sleep. I'd feel like ants were crawling on me and inside me, and I just felt bad. Now, I had learned, it's only been over the past 6 months to a year that I've started using a glucometer, so I never really thought, again, an old ER doc, didn't think to get a glucometer and test it. I never really thought to test my blood sugar, but I did think to eat something or drink something, and I had found eating or drinking something usually helped. So often I can go back to sleep. 4:30, I wasn't able to go back to sleep. And actually, I happened to look at my phone, and it looked like a text went off. I do work with MD Live, or I used to do some work with MD Live, not much anymore. It's a telemedicine group. They're out of power and they're texting me at 4 in the morning. It was a mistake, and they admitted it. But again, I couldn't go back to sleep. And I figured out later it's because I had epinephrine just ripping through my system. By 5, again, I couldn't sleep. I decided, you know what? I should go down and check my blood pressure. Maybe that's the problem. And while I'm at it, I'll check my glucose. The blood pressure was great, 108/76, but the glucose was 50. A lot of you aren't going to believe that. But just wait. At that point, I felt really bad and didn't think about this being an opportunity to share experiences and information. So I hope you'll, again, forgive me of that. Now, I used to love these. They're Dove bars. It's a sorbet bar with a dark chocolate. And before I became significantly insulin resistant about, again, 6, 8 months ago, I used to love these things. I would eat a lot of them. We happened to have some in the freezer. I knew it. I haven't had one in maybe 6 months. Even though I wasn't thinking very well at all, I did think, you know what, I need to get something with sugar, and I just saw these, so I'll try one. As I said, you often vomit. You feel really bad, and that's what I did. Pardon the gross image. what's interesting though was I began to feel immediately better. I didn't feel better after the Dove bar. And as you can see, I vomited the Dove bar back up. But 1 minute after vomiting, I felt a lot better. I decided I was going to get up and go to the kitchen and try to eat something. I didn't make it very far. I made it about halfway out of the bathroom. That's the bathroom ceiling here, the hallway. And it wasn't because, I didn't lay there because the bathroom tiles felt that good. I laid there because when I tried to stand up, I felt bad. So even though I felt a lot better than I had just earlier that morning, a few minutes earlier when I measured it at 50, it was still only 63. At this point, though, I had figured out that this could be a very helpful experience to share. Now, let's go. Speaking of sharing some of the science around this, let's talk about this for just a second. I was feeling much better. I was able to sleep a couple of hours, and when I awakened, I had still not been able to increase my glucometer level. I had gotten it up to 63, then maybe up to 67 after sleeping a couple of hours. Now, why is that? Well, I'm on metformin, 500 milligrams twice a day, have been since my oral glucose tolerance test went to 110, 165 at a 110 fasting, 165 at a 1 hour, and 155 at a 2 hour. I've been with that and a low-carb diet and exercise, both of which I was already doing. I've been able to keep my glucose values mostly under 100. I haven't seen much at all. I've never had a hypoglycemic episode that I knew of. Maybe I slept through a few since then, but obviously I've had one now. Now, why do I bring up metformin? If you look at the science literature, they'll say metformin doesn't cause hypoglycemia. See, now here's one of the symptoms I do have, and I've had this my whole life, especially after waking up with one of these episodes. I start getting what we call word finding problems. If you look up word finding problems, that's also one of the first things that you see as you start to develop senility. Now, obviously that catches my attention as well, but I have to tell you, I had that in college. So I have to discount that as a early symptom of senility. I will tell you, though, it does go along with these episodes. Now back to the metformin. I actually had a patient I start a lot of patients on metformin because we find a lot of patients that have insulin resistance. That's just not been picked up by their docs. The standard in medicine, if you look for it at all, is to look at hemoglobin A1C. That's not nearly as good as getting an oral glucose tolerance test. We do that, and we find a lot of people who thought they were okay, but actually had significant insulin resistance. Now, I had a patient, a very, very knowledgeable patient, call me or send me a text after starting on metformin, telling me he needed to drop his dose because he was hitting the 50s and 60s. And I said, well, it's not. Look at the literature. It doesn't cause hypoglycemia like insulin or the sulfonylureas or the another word finding problem, the DPP4s, Victoza, some of the medications that drop your blood sugar. But here's what it does do. And he then went back, looked, investigated, and he found out, you know what? I was cranking too hard on my diet and my exercise at the same time. Well, guess what? I was too. And I told you a little bit about that already. I've been increasing my squats, my deadlifts, and I tripled my hill intervals. The tripling of the hill intervals came about 36 hours before I had woke up with this hypoglycemic episode. So that's, again, classic for my pattern, isn't throughout my life. Now, let's go back. What's the issue about metformin? If metformin does not drop your blood sugar, why am I bringing it up? Well, for two reasons. One, to assure you that it does not drop your blood pressure, but it does slow or stop your liver from making sugar and putting it into your blood when your blood sugar drops for other reasons. So when you have hypoglycemia, if you have metformin on board, or if you have alcohol on board, your liver can't hydrolyze that glycogen and then increase your blood sugar. Maybe that gives you a clue, if you've ever had a hangover, why you feel as bad as you do for as long as you do until you eat or drink something. So that covers the information there. Back to my episode. After I got up to 63. I showed you that a minute ago. And that 63 felt worlds better, but again, I could not get up. I thought I could get up and go get something to eat. I could not get up. I decided to lay on the floor. After a few minutes, I did decide, you know what, I can go to sleep. I know I need to get something to eat, but or drink, and I didn't want to. Actually, I did. I got some tea, but it was bergamot tea. Look up bergamot tea. I've done a video on it. Bergamot tea has some anti-diabetic qualities, and again, I just was not thinking, and I could not eat. But I was able to go to sleep, and again, I felt worlds better at 63 and was able to go to sleep for 2 hours. I woke up, I felt a lot better again. My blood sugar had only gone up for 4 points, at least by glucometry. That's not a significant number. But I was feeling better. Laid there, like a teenager, sometimes they wake up, they just can't get up, they feel bad, they want to stay in bed. That was the way I felt. Usually I get up 5:30, 6, 7 o'clock, and I cannot sleep, cannot go back to bed. I got plenty of energy. That's when I get my best thinking and best work done. Here, I was not thinking, I was not able to work, and every time I tried to stand up, I felt bad. Well, I still had a blood sugar of 67. So that was, by the way, if you're looking at the times on here, you'll see that these times don't correlate. This was actually about 9:17. Now, that's not what it says. It's because I haven't set the clock on my glucometer. But I did take a picture to document the actual time. So it was about 2 hours, 50 minutes off. At that point, I had obviously been telling myself for a while, I need to eat. So at that point, I did think about cheese, and I did think I was able to eat some cheese. There's 60 calories in that Baby Bell, I think. It did help. As you can see here, that and a little bit of time, laying down some more, unable to sleep, but laying down, I'm slowly edging back up. Why didn't I just drink some sugar or eat some sugar? Well, I've told you that a couple of times. People came in hypoglycemic to my ER, and I put that sugar in them, and they were great. I knew that needed to happen, but it's very hard to make yourself do that when you feel that way. And so that's another thing to keep in mind. That's a fairly dangerous situation. I'm used to it, and I relay it with some levity, but we'll talk about some of the problems. Your mind is not thinking very well. And if your mind's not thinking well, you can be in a dangerous situation. We'll talk about that a little bit later as well. So here we go. At 8:40 plus about 3 hours, at about 11:30, I am feeling a lot better. My blood sugar has climbed slowly back up to 89 on the bergamot tea, well, on the cheese, possibly being fought a little bit by the bergamot tea. And I was able to eat breakfast. Didn't think to take a picture of that, but here it was. I had some more cheese. I had an egg white omelet with turkey sausage and some plant phytosterol margarine. So here it is, about 12:30, and I'm feeling almost normal. I'm feeling a little bit washed out for obvious reasons, but I'm up to 92 at that point, and that's just not a problem. That was about 12:10. It was 11:30, I think, that I ate breakfast. You know, I shared with you that these can be dangerous situations. You can have seizures with blood sugar in the 50s, 40s. Anything below 70 is hypoglycemia. And anybody below 70 that came into my ER, I would give them an amp of D50. Not only seizures and other problems, you can do some really bad things from your judgment perspective. This wreck happened because a diabetic on insulin got hypoglycemic and drove over the curb. Most of you have heard about hypoglycemic episodes and some of the dangers associated with them. Now here's I mentioned early on that there's some special significance on this for baby boomers. And that has to do with birth weight. I was a 10.5 pound baby. 8.5 pounds is called macrosomia. That is a baby usually delivered by a mother who has gestational diabetes or has diabetes, gestational or otherwise. These babies have significant risk for developing diabetes later on. In some studies, a third of patients over 8.5 pounds at birth were born to mothers with word finding problem again. Were born to mothers that had diabetes. And so what's going on there, logically, is that your organs are being formed in an environment with increased sugar. That evidently has some impact on your pancreas, the beta cells that are developed. There's some thought that maybe you start off with hyperactive beta cells, and maybe that helps you, like me, have some episodes with hypoglycemia. But it clearly, and that's not been that well researched and documented, the hypoglycemia connection, but the type 2 diabetes connection has. There's a very strong familial diabetes connection. We know from other work, there's a genetic component, 9p21, which used to be thought of as the heart attack gene. And even before that, the cancer gene has been found out to cause heart attacks and cancers due to its diabetes. However, there's some other associations as well. Maybe not all of this is just genetics. Maybe it's just the fetus developing in a hyperglycemic environment. Well, a few other things about my family. Both of my parents had type 2 diabetes. My dad was north of 350 pounds. He was my height, 5'10", so he had more than two of me. I'm currently 150 pounds. I got up to 190 in college. At that point, my blood pressure got up to 130 over 90. So I decided I needed to lose weight. I got back down to 155 and have stayed between 150 and 170 my entire adult life. As I've said, I've had routine episodes where I'd wake up in the morning feeling jittery like that. It's only recently that I decided to check my blood glucose. Although I was smart enough during these episodes to decide to try to eat something or drink something, and I did get some significant improvement. So if you're my age, 60, if you're a baby boomer, we didn't know back then that being a big baby was a problem. We thought you were just a big, fat, happy baby. Maybe not so much. Maybe you have some risk for some of these hypoglycemic episodes, and you clearly have risk for type 2 diabetes. As you see, I've gone on a long time. There's a lot of information to cover here. Thank you for your interest, and we'll do some more science around hypoglycemia and a thing called the Samoji effect. Thank you.